Hey everybody, Dr. T here. I got JJ. We're going to do some foam roll demo exercises. Foam rolling can be very important and beneficial for everybody out there, especially the desk workers, because they put their hips in this position that tends to irritate the muscles, that creates trigger points and starts to limit the hip mobility. And so JJ is going to do some demoing here, and I'm going to walk you guys through what she's doing. Of course, you've got massage balls that you can use in the hip with a variety of ways. We're going to be doing the foam roller today. One little word of caution with these balls is that if you tend to get these on the sciatica or the sciatic nerve in your hip, you can contuse the sciatic nerve. And so it is important to be careful with these little balls because they put more focalized pressure in the hip, which can cause some pretty significant injuries to that nerve. And so we have blue and black ones here at Denver Chiro. The black ones are a little bit harder. These ones are a little bit softer, depending on your weight. Most people do pretty good with the black ones, but they are a little bit harder, so you might want to try a blue one first and then graduate up to a black one. And so we'll start off with JJ putting equal amounts of weight on both of the sits bones, the ischial tuberosity. And we're going to do the focus of this video will be on her right hip. So JJ, why don't you put a little bit more weight on your right hip? There you go. And so now it's mostly on your right hip. And we're going to, and then why don't you slowly roll up all the way to the top of your hip. And then just keep going back and forth all the way to the bottom. And so the problem that I see commonly when people start to foam roll the hip is that they might not necessarily go all the way up to the top of the hip. Men have traditionally taller hips. Women usually traditionally have more wider hips. And so it's important to kind of feel where that bone is on the top of your hip to see where it ends, because the muscles go all the way up to the top. And so don't neglect those muscles all the way up there. That's really important. And then same thing, you want to go all the way down to your sit bone. And once you do a few passes, keep going, that'll help warm up the area. And you'll notice as you go from the top of the hip all the way down to the bottom of the hip that you'll notice some sore spots, some spots that are a little bit more irritable than others. And so once you find one of those sore spots, and everybody's got them, I want you to start micro foam rolling. So just going back and forth, just like JJ is now. Just kind of like we're trying to flatten that spot. That's what you want to visualize. Once you go back and forth for about 10 to 20 seconds, I want you to sustain pressure on that one tender spot. And so she's putting some pressure in there, and this is a trigger point release technique called ischemic compression. The idea is that we're starving that area of oxygen, and what the body's wanting to do is wants to get blood into that area. And so all of the vasculature around that trigger point will vasodilate. The vasculature will get bigger so blood can get in there. And you'll notice if the pain was about 5 out of 10 on that one irritable spot, as 10, 20 seconds go by, that 5 out of 10 will drop slowly to a 4, to a 3, to a 2. And so the next part of the sequence, once you get some of the pain out of that one particular spot, is that we're going to involve some active range of motion while you foam roll. And so you'll start with the foam roll right at the ischial tuberosity. And then as you roll up to the top of the iliac crest, you'll bend your knee. And so we're lengthening, particularly the gluteus maximus, and then and you'll straighten your leg as you go back down. So she lengthens the muscle as she foam rolls it. And then she'll kind of shorten the muscle as she goes back down. This is to help restore the natural range of motion of the hip. It's also helping to get some of the layers of the gluteal muscles to improve their relative motion to one another. There's quite a few muscles in the hip, and so differentiating the motions while you foam roll can help improve the mobility of the hip hip and also the relative motion compared to the other muscles in the hip. At this point, you can go a little bit more on your side and you'll do the same sequence. So we're not quite on the IT band, we're a little bit more on the gluteus medius and minimus now. And so she'll do the same thing. She'll go all the way to the top of the hip and then all the way to the bottom of the hip. And so we're going this back and forth mechanism. And then just like we did initially, you find a hyperirritable spot, a little painful spot, a knot, a trigger point. And then you start to micro foam roll it. So just small back and forth oscillations just to help break that knot up. And then once you do that for 10 to 20 seconds-ish, you can sustain some pressure on that spot, just like JJ's doing right now. And then you'll notice the longer you're on it, the pain will start to slowly go down. And then once that's down, you can kind of do a few more passes around that area just to make sure it feels good. And then now you want to go all the way to your side. So let's put your ankle in front. There we go. And we're going to do the same concept. We want to start all the way at the bottom and go all the way at the top. That's good. And you have to be on a pretty good surface. A slicker surface is going to be a little bit more difficult versus like a carpeted surface where you can control the speed of the foam roller as well. And so, good. And then just like last time, once you find one of those particularly irritable spots, you want to micro foam roll it a little bit. And then after that, you want to sustain pressure on it for 10 to 20 seconds. And then after you sustain pressure, we'll want to add a little bit of active range of motion. And so with this one, go all the way down to the bottom of the greater trochanter of the hip. And then as you go up to the top of the hip, JJ will now raise her leg up towards the ceiling. So we're lengthening gluteus medius and a little bit of the TFL. And then go back down. This one's a little bit harder because you're asking a lot of your adductors. And then lengthen, yeah. And then shorten. Once you do this side of your hip for about a minute or two, you're going to want to switch to more of the hip obliques. And so let's go back to both ischial tuberosities. Yep, you're sitting on it. And then put yourself at an angle to the foam roller. Yep. Once you get yourself to the angle of the foam roller, you can repeat the same process that we just went over with. So let's go back and forth. You'll notice that when you put yourself to an angle of the foam roller that you get a little bit different parts of these muscles that we're trying to foam roll. And so we don't need to go through that process, but I do want to show you that you can get into those muscles a little bit more with crossing your legs, a figure 4. And so JJ does her figure 4, and you can start with you being completely perpendicular to the foam roller, which we can do for this example, and then you want to work your way to more of an angle to the foam roller. So with this one, the same concept. We start all the way at the bottom of the hip where the ish tube is, and then you roll all the way to the top of your hip. And same process. Once you find one of those irritable spots, those knots, you'll micro foam roll it, and then you'll sustain pressure on it. And then once you've gone through that sequence, then you can add some range of motion to it. And so start at the bottom of your hip with the ish tube. And now as you go to the top of the hip, you'll bring your hip to your shoulder. And so you'll lengthen the muscles, the oblique muscles in your hip. And then you'll shorten them. And you'll go back in this, to their shortened position and then their lengthened position. And you guys might want to just pull up some pictures of the anatomy of these muscles in your hip. There's quite a few muscles that you're trying to dig into, and you might as well take that next step in learning what these muscles are called. And so I would definitely pull up some anatomy so you can visualize exactly what you're doing. And so do this ideally every day, especially if you've got some nasty trigger points in your hip. The hip always likes to carry lots of trigger points. It's a very powerful muscle on our body, and a lot of the people that come in here, besides back pain, they typically have some one-sided hip pain as well. So leave some comments in the section below. We want to help you figure this out to make yourself feel better. And if you're one of the patients here, I would like you to continue doing this every day until you start to get some significant relief in your hip. Talk to you later.